Hello, lady.
Hello.
I'm Ibrahim Diallo. I'm the nurse practitioner. Today, welcome to the clinic. We'll be doing an examination, but before, do you give me permission to record the video for my professor?
Yes.
Great. That sounds good. Thank you very much for that. So, basically, we're going to do a cardiovascular examination. And first, I'm going to check your blood pressure, and then I'm going to inspect your chest, and then I'm going to, percuss your chest, and then I'm gonna auscultate. I'm gonna listen to the lung sounds, okay? And then we're gonna check your upper extremities and your lower extremities, and to make sure you have a good, circulation and good pulsation, okay? So first, we're gonna start with the jugular vein, pressure measurement. Please look to your right. As you can see here, the jugular vein distension. We're gonna be using the external jugular vein to actually measure the pressure. As you can see here, when she's laying down, I can see the pulsation already here. So I can see this little pulsation here. Sorry, miss. As you can see the pulsation right here, so I put a mark over here, right? And then the sternal border right here, I'm gonna count to 1, 2 to the second ribs, right? And then I'm gonna measure this distance, right, from here to here. The pulsation you can see, it's about, I would say, like 5 centimeters. Okay. So what does the jugular vein pressure is actually is not, it's not palpable, but as you can see the pulsation, this indicate, like, how high, the tube that is waiting to refill the right atrium, how high is it, over the neck, right? So that is great. So second, I'm going to, please keep your head straight. There you go. So I'm going to, palpate, her temporal arteries on both sides. Well, actually, the temporal arteries are palpable, right? They have an upstroke, literally about, there's no true. Wait, let me see. Okay, listen to the. I'm gonna listen with the diaphragm. See on this side. Then I'm gonna use the bell of the stethoscope. So, great. And then the next is I'm going to, check the carotid arteries. First, I'm going to, please look to the left, to the right. I'm going to try to palpate, the carotid artery, which is actually palpable right here. And it's like a, a brisk upstroke, and the pulse is about 2 plus, just like on the temporal arteries. Please look on this side. I'm gonna try to palpate on this side as well. It's the same thing. Brisk upstroke with 2 plus. Now I'm going to listen to the carotid artery for trill and bruit. I'm gonna listen with the diaphragm first. I'm gonna listen with the bell of the stethoscope. Look to the other side. I'm gonna listen to the other side with the diaphragm, and then I'm gonna listen with the bell of the stethoscope. Great. Just listening to the carotid here and the temple. There's no bruit. There's no troll. And the second thing I'm gonna do is I'm gonna check your blood pressure. While you're sitting down, I'm gonna check your blood pressure while you're laying down, and I'm gonna check your blood pressure while you're standing up. And that's going to be bilaterally, right? To the left and to the right, okay? And over the inspection part, I'm gonna look at your upper extremities, for warmness, for color, right? And then I'm gonna check your nails, for clubbing, for any cyanosis. And then I'm also gonna check your other arm right here for warmness and for discoloration. I'm gonna check your nails for clubbing and cyanosis. You have a good circulation, the body's warm. And as well, I'm gonna look at your lower extremities to the left side. The body feels warm, there's no discoloration as well. And I'm gonna check your capillary field here. That's less than 3 seconds. I do not see any clothing or any type of hemorrhage signs. So you have a good circulation on your legs as well. And so like after I check your blood pressure, like I said, I inspect the chest cavity area to see if you have any type of abnormality, right? And I do not see any type of you know um apical pulsation visibly over here, and I don't also see any pericardial pulsation. So the chest is moving freely, and I don't see any constriction or any type of barrel or pigeon chest. Okay. um so after the inspection, I am going to proceed to the palpation now. I'm gonna palpate your sternum right here. If you feel any tenderness, let me know. You feel any tenderness?
No.
Do you feel any pain?
No.
All right. So as you can see, the sternum is midline. There's no deviation, which is a good sign, and the chest is rising and falling, symmetrically, and there's no constriction, or retractions on the chest. I am also going to, palpate the, abdominal aorta. I'm gonna put a, deep pressure right here. You feel any pain?
No.
I can actually feel the, the pulsation over here. It's a brisk upstroke about 2 plus. And then I'm gonna feel for the iliac branches on the right side. Good pulsation, 2 plus. And then I'm also gonna palpate, the left iliac artery. Good pulsation as well. And then I'm gonna palpate the femoral artery right here. It's great pulsation, 2 plus. I'm going to palpate the right femoral artery. That's also a good upstroke, 2 plus. And then I'm going to palpate the posterior the posterior pedialis pulse right here. This is a good pulsation as well, 2 plus. And then I'm gonna palpate the dorsalis pedis. This is 2 plus as well. And then over here, dorsalis pedis and the posterior pedis. And then on the upper extremities, I'm gonna check the radial pulse. Very good pulse, 2 plus. I'm gonna check the brachial pulse. It's great. I'm gonna check the radial pulse on the right, and then the brachial pulse to the right. So as you can see, she has like symmetrical pulse, strength, on both sides, left and right, from the temporal to carotid to the brachial, radial, abdominal, femoral, and dorsalis, posterior and the anterior. All of them have a brisk upstroke, and the strength is about 2 plus. So after the palpation, now we are going to auscultate your lung fields. Okay. Um, what I'm going to do is I'm going to start, with the carotid arteries, which I've already done, right? I already did the carotid arteries, but I'm just going to do it again for, the exam purposes. So I'm going to listen to the carotid arteries for trill and bruit using the diaphragm. Please look to the side. Great. I'm going to listen with the bell. Great. Please turn this side. I'm going to listen with the diaphragm. I'm going to listen with the bell. Great. Now I'm going to listen to the, to the you know, to the lung sounds area. So what I'm gonna do first, I'm gonna use the ladder technique. I'm gonna start with the pulmonic, with the aortic, right sides right here, the aorta, and then I'm gonna listen to the pulmonic. Then a little bit down here, the Eaves point, and then over down here, the tricuspid, and then down here, the mitral, and I'm going to listen to the well, let me start first. I'm gonna now use the bell of the stethoscope to listen to the same way, the aortic valve, and then the pulmonic valve, and the Eaves point. Okay, for the Eaves point, this is on the third intercostal space. I'm gonna ask the patient to take a deep breath in and hold it. Okay, take a deep breath, hold. 1 second. I'm gonna use the diaphragm again. Great. There's no split S1 and S2, on the Eaves point. And usually if there's the tricuspid valve and the mitral valve are closing at a different time, usually you can hear those S1 S2 split sound. So I'm gonna continue to listen to the abdominal aorta using the bell of the using the diaphragm of the stethoscope. Take a deep breath. Breathe. Just breathe normally. So I'm gonna use the bell. And I'm gonna listen to the branches using the bell, the branches of the iliac arteries. Then I'm gonna use the diaphragm again to listen to the left iliac artery and the right iliac artery. And then I'm gonna listen to the femoral arteries to the left with the diaphragm, and right femoral arteries using the diaphragm. Now I'm gonna use the bell. I use the bell here. So I listen to the the aortic, the aorta, the pulmonic, the tricuspid, the Eaves point, the mitral valve, the aortic aorta, the femoral arteries left and right. It's all symmetrically 2+ pulsation with the upstroke, brief upstroke. I do not hear any trill or bruit, and the pulsation sounds normal. So Now I am going to, let's see, 1 second. 1 second. Patient auscultated all belong fields. Color, awareness, and then those are the spades. I did all that. So basically, I observed, I inspected the chest, right, and I do not see any pericardial, pulsation or, apical pulsation. And then on the palpation part also, I palpated the point of